Hi, my name's Diana Thompson. I'm a massage therapist, and I am doing a video for you to see how the CranioCradle can be used in therapeutic sessions. I'll be demonstrating various uses and what I might do during a session to augment the CranioCradle. And at the end of the video, we'll demonstrate some self-care uses so the patient can take this home with them and use it on themselves. Always ask the patient for some feedback as we're placing it in different positions. We want to make sure that it's comfortable, that it's accomplishing what we're setting out to accomplish, and that it's not too high or too low on one side or the other as we bridge the occiput, bridge the thoracic spine, and bridge the sacrum. The first position that we're going to demonstrate is the stillness position. When you use the CranioCradle, you'll want the angle of the cradle down towards the thoracic cage, and the head will rest up on the cushions. So Davida, I'd like you to lift your head up gently. I'm going to slide this in, and then go ahead and lay back on that. Does it feel like that's in the right spot?
Needs to be pushed this way a little bit.
Great. How's that? Good? Good. Comfortable?
Yes.
So this is a great resting position. You can prepare your room for the session. You can have the patient do some deep breathing exercises, invite them to become aware of how they're feeling and where their pain is today. It's also a great position for doing some posterior neck work, so you can really reach behind the neck and get some of those nice strokes along the paraspinals on the posterior side, and the head is lifted up, making that possible. So it does give you a little bit of lift so that you can do some hands-on work as well. The second position we're going to demonstrate is the rocker position. So we're going to take this, put it on its edge, and have her rest her head in the groove and then rock the cradle back and forth. So when you're ready, Davida, I'll have you lift up your head. We're going to slide this in. Does it feel like your head is resting evenly between the two bumps?
Yeah.
Okay. So passively, I can rock her back and forth and just give her an idea of how this CranioCradle works in this position. And once she gets a sense of that, I'll say, okay, Davida, now you actively rock your head back and forth, just to the range that it feels comfortable. It surprisingly feels stable, supportive, and it's great for someone who's hesitant to move. There's some fear based probably on a traumatic injury. If they just had a whiplash injury, they're not very comfortable about moving their head through space after such a jarring trauma. And this gives them the support without trying to trust my hands to guide her through a range of motion. So she's in control and she feels supported. So tell us, Davida, how does this feel for you?
It's surprisingly supportive. It feels really safe to use.
Great. The third position we're going to demonstrate is the decompression position. This is not in the flyer in the box, nor is it on the website. So this is one that I like to use a lot. And I just caution you to use it just for 2 or 3 minutes. This is not one you'll want to leave the room and have them resting on it. So pay close attention. What we're going to do, unlike the previous two positions, is we're going to rest the bumps on the CranioCradle underneath the occipital ridge. These points at the end, the tips, will go right underneath the occipital ridge and compress into the suboccipital muscles. So I call this the decompression position. So Davida, I'm going to have you lift your head. I'm going to slide this underneath, and we're going to get this right underneath the occipital ridge. Does it feel like a good position for you?
It's at the little high on the left.
All right, let's correct that. Better? You're resting right in the middle, and the points are right up underneath your occipital ridge.
Mm-hmm.
Great. So this is a great position just for decompressing those suboccipitals, very commonly tight with a forward head posture. The fourth position that we'll demonstrate today is called the base position. It's great to use instead of a pillow. It's a very comfortable position. Unlike the other positions that we've demonstrated, the ankle will go up towards the top of the head instead of going down towards the thoracic cage. So we'll keep it up. The head will rest in the valley here, and the two bumps will go underneath the neck. So if you're ready, Davida, I'm going to have you lift your head up, and we'll slide this in. So nestle it underneath her neck. Make sure her head rests in there. Shall I move it for you, or is that a good position?
Perfect.
Good. The base position is not only a nice comfortable pillow for the patient to lie on, but it's also great for traction. So as she rests into it, if I just scoot it up a teeny bit, so lift your head slightly, there we go. We can use it as a way to get some nice length out of her cervical spine, and at the same time we can get some nice counter length out of her shoulder girdle. So I can lift up on her scapula, grab onto the edge of the scapula, grab onto the clavicle and the head of the humerus, and just give a nice stretch. So I've got the cranial cradle giving me a counter traction that way, and then I'm doing a manual traction this way. We're now going to demonstrate some cranial cradle positions into the thoracic spine and cage area. So in a minute, I'm going to have Davida lift up, and I'm going to place this cranial cradle along her thoracic spine. At about T6, T7, I'm going to switch it so that the angle of the cranial cradle goes down towards her sacrum. On the upper part, I tend to prefer to use it so that the angle goes up towards her head. So again, we'll just find different positions along her thoracic spine for a number of reasons. We can mobilize ribs in this position, and I'll show you how to use that in a minute using this as an extra pair of hands. It's also a great way to get some of those trigger points, so you can put them right on some tender points and use that as direct pressure to help relieve the pain. So Davida, I'm going to have you sit up gently, and I'm going to slide the cranial cradle underneath your ribs. So when you're ready, great, and come on back down. So I want to make sure that your spine is right in between those two bumps. Does that feel like a good position for you?
Mm-hmm.
All right. So once we've got the cranial cradle underneath the rib cage, we can use it as an extra pair of hands, providing some nice counter pressure up from the table while we can mobilize some ribs and the clavicle pressing down. I'm going to show you several different positions for the cranial cradle. So if you're ready, Davida, I'm going to have you sit up again. I'm going to slide this down a little bit, so go ahead and try that position. Does it feel like your spine is resting between the bumps? Great. So now you can see it's lifting up her chest here, so I can really work on that sternum and rib attachments in here. I can also open up her axilla and get the whole unit to move with that counter pressure coming up from underneath. I'm going to have you lift up one more time, and I'm going to turn it around and get some pressure up this way. So we're in the lower part of her thoracic spine. So the lift is coming from here, and I can use this to really get underneath her diaphragm. So I'm lifting underneath the rib cage with that counter pressure coming up, and it's giving me a nice angle to get some work done in here. There's one more thing I'd like to show you, and that's the use of two cranial cradles side by side. So Davida, if you could lift up again, nice and easy. So I'm going to put the cranial cradles like this underneath her thoracic spine. So go ahead and lay back on this. Yeah, make sure it's comfortable. Does that feel like, again, both pieces are between your spine is between the both heads? The
Yeah.
bumps? All right. So you can see how this really opens up her rib cage. I can do a lot more with the shoulder in this position, with the rib cage in this position. We can get some nice movement going so she can rock around this very comfortably. There's no hard edges when you use two side by side. The final therapeutic position that we're going to do today is for the hips. There's 3 different ways you can use the CranioCradle for the hips. The first one, with the angle facing down towards the feet, you'll rest it underneath the sacrum so that the bumps are in between the SI joints. It makes for great traction and a great extra set of hands. The second position that we're going to do is the reverse. So the sacrum will rest on the angle of the CranioCradle, and the bumps will be just off the base of the sacrum, pressing up into those external rotators. So great for trigger points in the piriformis and other external rotators, and also great to get some good pelvic floor work done. You can do either of these positions using the flat side on the sacrum as well. So I won't be demonstrating that. We'll stay with bumps up for the purpose of this video. Davida, I'm going to have you bend your knees and stand your feet and lift your pelvis up for me so I can slide the CranioCradle right underneath your sacrum. So what I want to do is make sure that the bumps of the CranioCradle are right in between your SI joints. So go ahead and rest back down on the CranioCradle and let me know if that feels like it's in the right position for you.
That's good.
Good. It's great to get some feedback from the patient on this one because it's not always easy to get it in quite the right position. We have the counter pressure coming up from the table with the CranioCradle right on the sacrum. So as you can press down on the pelvis, you're going to get some nice SI joint traction out of this. So use that CranioCradle as an extra pair of hands as you work on the hips to try and get more range of motion out of that SI joint. The next position that we're going to do, so go ahead and bend your knees, stand your feet, lift your hips up for me. We're going to switch it around so that the angle goes up towards the head. The bumps are just off the sacrum, so the sacrum is resting on the angle of the CranioCradle, and the bumps are providing some pressure right up into those muscles that attach onto the border of the sacrum, the piriformis, the other external rotators. As you work in here, you can get some great pelvic floor work done. So you've got that counter pressure up into the muscles that attach onto the sacrum, and you can provide some downward pressure onto the muscles as they attach onto the pubis and the iliac crest. It's possible to use more than one CranioCradle at a time. So I've set up the cradles in a position that I like to put my patients on if I need to have them just rest for a few minutes while I go get an ice pack or have them lay with an ice pack on. So I use the traction position or the base position for the head, the SI joint traction for the hip, and then the bridge position with using 2 CranioCradles together in the middle. And your patient can lay over this and get some nice lengthening and relaxation all at once. The CranioCradle makes a great self-care tool, so our patients should be taking them home with them. It's nice and soft, so it feels safe, it feels supportive. They can try all the ways that we use them already. So we have our stillness position, we have our rocker position, and we have our base position. So all of those are really helpful for the client. Same with the thoracic cage. We tried a few different positions here, and we also put 2 CranioCradles together so they could really open up their chest. I have found some patients to be very creative and turn them this way, getting trigger points right between their scapula into their rhomboids. So they can nestle these in between their scapula, press them right up into those trigger points on the rhomboids and get some nice relief that way. Same with the hip. Again, they could do the SI joint traction this way, They can do the trigger points into the external rotators this way, or again, they can try them both with the flat side up against their sacrum. I had a client be very creative and think about using it underneath her knee, and it really pressed up into her tibia and fibula and made some nice space in her knee, and she was able to walk more pain-free on her knee. So you can be very creative with the use of this and just invite your patients to try different things. Find the pain, put the cranial cradle into the pain to relieve the pain. Many of our patients experience pain while sitting. They can use the cranial cradle to help relieve pain while they're in that position. So they might be sitting at work, sitting watching the television, or sitting on an airplane. This is small enough they can pack it in their suitcase or in their purse. It travels very easily, or have an extra one in their car or at their desk. We'll show you some uses. So you can place the cranial cradle at various points along the thoracic spine, and just leaning back into the cranial cradle can help apply some pressure and relieve the pain. You can adjust the position wherever the patient needs it. They can even turn the cranial cradle over, place it on their sacrum or in their low back, and experience some relief of pain there as well. In summary, remember, you can use the cranial cradle throughout your therapeutic sessions as a way to provide traction, as an extra pair of hands, and as a way to relieve pain as you use it into those trigger points. Send your clients home with a cranial cradle so that they can practice self-care in between sessions. And use your common sense. Any kind of care is contraindicated in some situations, so know what your contraindications are for the types of therapy that you provide and apply those same principles to the use of the cranial cradle.